ready. All right, here we go. So today we're talking about anti-inflammatory living for orthopedic health. My name is Saloni Sharma. I'm a physician and acupuncturist here at Rothman, and I'm medical director of the Orthopaedic Integrative Health Center. So let's get started. So if we were in person, we'd do a show of hands. How many people think we have an inflammation crisis and a pain crisis? And unfortunately, the truth is we really do. Inflammation is contributing to arthritis, back pain, joint pain, diabetes, heart disease, dementia, and autoimmune disease, just to name a few. So this really extends beyond orthopedics and really is whole body health. We have a pain crisis, we have an opioid crisis, and unfortunately, our healthcare system really focuses on saving lives, but not quality of life, and not so much on prevention and building health. So our goal is to live better and age better with less pain, less inflammation, less stress, less disease. And that's why we're talking about this today. So our objectives: define orthopedic integrative health and the Relief 5R program, understand why these factors matter for you, and learn how this approach can help you. So what is orthopedic integrative health? I think that's probably the first question. So if you can see the little rings on the screen, it's a combination of conventional and traditional orthopedic care, but it also borrows evidence-based integrative medicine and evidence-based self-care, which is lifestyle medicine, to give us the best of both worlds, or really all three worlds for you. So we're going to talk about lifestyle factors, which means stress, diet, nutrition, specifics, as well as sleep and relationships, and how that affects pain, inflammation, and recovery from an injury, or even recovery from a surgery. So it is a partnership, which I think is unique in some ways. We're really a team working on improving your health together. It's customized care, which is really unique in this day and age. It's patient-centered. We're really focused on you and how your inflammation, injury, or pain affects your daily functioning. We're treating the cause. We're sort of looking at root cause of inflammation, not just focusing on the symptoms. It's evidence-based and it's really innovative. We have several paths, like you can see over here on the right. We have something to get you ready for surgery or to help you recover from surgery. We have something to manage joint pain, spine pain, or dysfunction, muscle aches, and just a wellness plan too, if you're trying to live better and age better, developing a customized wellness program. So why does this matter? And believe it or not, out of the top 4 causes of disability, orthopedic causes are among the top 3. And low back pain is number 1, followed by musculoskeletal pain and then neck pain. Depression is often linked to ongoing pain and dysfunction as well. So this is a big deal. This is disabling our country and disabling our loved ones. We really want to do what we can to prevent this, and if it occurs, to manage it better. So let's take a minute to talk about some definitions. You may have heard of lifespan, which is the number of years lived, but sort of the new target is health span, the number of years lived in good health with the ability to participate in life. So these are the stats for the United States. The average health span is 63, but the average lifespan is 79. That means there's 16 years where people aren't functioning the way they want. They can't participate in life and enjoy their life. So we really want to change that gap. We want to go from this image to the bottom image, where we optimize longevity and we have more healthy years where we can participate in life the way we want. This is from the Journal of the American Medical Association 2020. So this is sort of the medical journal. And they have a whole article about growing your health span. And a lot of it is about lifestyle factors. So it's different types of nutrition, it's physical activity, and it's also focusing on weight. And BMI is not the best measure, but maintaining a healthy weight for your body type. There it are. We're going to grow our health span, right? That's the plan. And so what can we do about it? How can we affect our health span or lifespan? Well, it really depends on the fuel. How we fuel ourselves impacts our gene expression. And this comes down to food, movement, sleep, stress, and relationships. And the reason these matter is because these are poorly done, meaning if you have poor nutrition, limited activity, poor quality sleep, trouble managing stress, and non-support relationships, this actually affects you at a cellular level and causes oxidation reactions. It affects your gene expression, and even it affects your gut microbiome, which is a really hot topic right now. These all cause more inflammation, more dysfunction, and really more pain. So what's our plan? Our plan is a Relief 5R plan. This is what we use at the Orthopaedic Health Center. This is something I've written about as well in my book. We talk about nutrition, regular movement, restorative sleep, building resiliency, and connecting with others. It's evidence-based, and it is unlimited with limited side effects. And the how of it is using microboosts. This is a term I coined, and it's little steps that add up to big relief. So there's one of the physicians I know, her name's Dr. Una, and she talks about learnitis. So in today's talk, and if you come and work with me here at the Orthopaedic Health Center, I'm really going to focus on microboost because I don't want you to have learnitis. Learnitis means you learn something or hear about it and you're like, well, this is interesting. That kind of makes sense. But then you don't have a practical plan to put into action. And we really want things to be practical and tangible. So throughout the talk, I'll mention microboost, and these are sort of the practical part of the lecture. So here's the 5R program. Again, Refuel, Revitalize, Recharge, Refresh, Relate. And starting with nutrition, you may have heard the term SAD, or the Standard American Diet. It's the acronym. So 90% of Americans report a poor diet. That means a lot of added sugar, excess salt, unhealthy fats, and some fats are good, but unhealthy fats, artificial ingredients, and a lack of vegetables and fruits. I really love this diagram because it really shows sort of like the value meal and how that impacts your immune system and inflammation at a spinal level. So ongoing SAD or ongoing inflammation causes ongoing pain. It actually decreases how well you can get better. In other words, it's longer recovery times when you have an injury. And they found these in research articles, and I have it all cited down here. It increases painful flare-ups, it increases fat mass, and it decreases lean body mass. So really want to stay away from the SAD diet because it is sad. It makes us sick, and it sets us up for standard American diseases. So what are we going to do about it? So part of the Refuel program is focusing on phytonutrients. Phytonutrients are found in plant foods. They give plants protection, strength, and color. For humans, they act like antioxidants, and they help limit inflammatory damage. Examples of a type of phytonutrient is polyphenols, including berries, turmeric, and green tea. There's been studies done on osteoarthritis, which is a wear and tear arthritis, and they found that increased dietary polyphenols, just type phytonutrient, has led to less oxidative joint damage, less cell death, more joint strength, less arthritic degeneration. And it's not just pain complaints, but it has decreased pain. They actually have seen changes on X-ray. So this is subjective and objective findings. So here's some microboosts. This is another study that just came out last year, the benefits of fruits. And the bottom line here, because I know it's a little bit of a busy slide, is that they have antioxidant effects. They support the immune system. They reduce inflammation. They actually take the same pathway that medications like ibuprofen do, which is kind of neat. They work in that same pathway to reduce inflammation. Berries are especially powerful, and you want to focus on whole fruits, not just juice. When you drink fruit juice, you lose the fiber and the other components of the fruit that can benefit you, and you just get the sugary part. So you really want the balanced intake. So here's that microboost I talked about. Try adding whole fruits to your plate this week. Fresh is better, but frozen's okay. And try adding a fruit of a different color to your plate every day for the next 5 days. Often fruits of different colors have different phytonutrients, and so they benefit you in different ways, which is why people say eat the rainbow. So a microboost is trying a different fruit of a different color every day this week. And there's just more and more. I could just keep going on about this. I don't want to dwell on it, but you may have heard of resveratrol. It's found in red wine, and so that's why people always talk about drinking red wine, but it's really found in berries and blue and purple foods. So you want to increase your intake of that. It's been found to help with inflammation and with joint pain. This is a nice visual, and it really shows on the bottom here the factors that can affect joint pain. So these are the things that are helpful. They found data for vegan diets, elemental diets, elimination diets, and the Mediterranean diet. I think the Mediterranean diet is the most well-known, and we'll sort of focus on that today because there's a lot of resources for that, and it's easy to add to your lifestyle. It's very similar to this diet, which is the anti-inflammatory diet. This is Dr. Andrew Wow's anti-inflammatory pyramid, and it's a lot of fruits and veggies, whole grains, some pasta, a lot of legumes, healthy fats. So like we said, some fats are healthy, fish. And then you can see that chocolate and wine are on the very top, and supplements, if needed, are on the top. They're not sort of the basis of our healthy diet. They are rich in phytochemicals, which, like we've talked about, can help with inflammation and joint pain, as well as back pain. Here's a resource, right? So here's a microboost. You can go to myplate.gov and take a look at the way your plate should be set up ideally, which is half vegetables and fruits, the other half grains and protein, and dairy if that works for you. It doesn't work for everyone. It's much better than this pyramid from 1992. You may remember this. I remember this when I was a kid. And it's tons of processed food, breads, white carbs, cereals on the bottom. And we really want it to be the other way, where the fruits and vegetables are on the bottom. And I think this plate resource works much better. This is the Mediterranean diet, which again is similar to the anti-inflammatory approach. Here's the microboost, focus on high phytonutrients, high fiber, omega-3, less processed food. So foods with less than 5 ingredients is ideal, less sugar. And then we'll talk a little bit about intermittent fasting. I really like this image because it focuses on being physically active and considering social connection every day as part of a healthy lifestyle and to reduce joint and back pain, as well as neck pain, musculoskeletal pain. Let's talk about the gut microbiome. So this is sort of a hot topic. They really found that the gut microbiome influences a lot of diseases as well as our health. So the gut microbiome is millions and millions of organisms, mostly bacteria, that live in our gut system, in our GI tract. And we want to have an ideal balance to promote good health. They help us process food. They help us process medications. They help us get nutrients from our food. They help us get vitamins. And if there's a misbalance in the gut microbiome, it's called dysbiosis. And they found this contributes to arthritis, the wear and tear arthritis. And it can also be fixed. So if we can improve our gut microbiome, it may help the progression of arthritis. So this is actually really neat. There's really not medications that are effective and without a lot of side effects that can do this. And so if we can shift our gut microbiome, this is sort of the wave of the future. We might be able to reduce arthritis progression and hold off on a lot of the wear and tear that we have with aging and really optimize the longevity in our health span. And like they talked about, it's actually something they're working on for medications now. This picture is really busy. I just really want you to focus on the circle part. And what you see here is that these are the things that disrupt the gut microbiome: high sugar, high fat, diet, and then carrying extra weight. Sometimes probiotics are helpful and prebiotics. I always like to say food first. So I'm not trying to tell people to buy lots of probiotics or prebiotic supplements or pills or drinks. It's really more of food first. And so that's the microboost here, right? So we don't get laryngitis. It's avoid added sugar, focus on prebiotic and probiotic foods. And you may say, well, what are those? So we'll get into that. And again, there is something called the gut joint axis. And the standard American diet leads to more swelling, more inflammation, more pain, more dysfunction. So we want to feed our gut microbiome so we have a good balance, can help with all inflammatory diseases, not just orthopedic. You want to keep hydrated, eat high fiber foods, real food, fermented foods are good. You want to avoid added sugar. So natural sugar found in fruits is fine if you're eating the whole fruit, but you really want to avoid added sugar. You want to avoid artificial stuff, processed foods, and you want to decrease these the best you can working with your physician. But getting back to our question, here's our microboost. Prebiotic foods are foods that support the healthy microbiome, and they actually feed the beneficial bacteria. So think of onions, apples, asparagus, artichokes, cabbage, almonds, leeks, flaxseed, seaweed, and leafy greens. And a lot of these things also help with eating the rainbow and the phytonutrients like we talked about. Probiotics are actually foods that contain the good bacteria. And they're cultured and fermented foods. Think about yogurt, kimchi, sauerkraut, pickles, miso, tempeh. And you really want to focus on unsweetened yogurt, right? Not tons of added sugar, not some of those tubes that my kids like. You want to stay away from those if you can. And they found that if you have an unbalanced gut microbiome, it actually causes more musculoskeletal pain. So it's really important to think about this gut joint connection and really the gut spine connection too. This is a little acronym I came up with, which is pain relief. These are the pain fighting foods. So the myth is sort of that orthopedic pain is not affected by food choices, and that's just not true. The food really programs us for more or less pain and inflammation. And so we want to focus on phytonutrients, antioxidants. And these are some things we get in with the program and in the book too. Glycemic index low foods, limiting added sugar, focusing on real foods, so not processed food, essential fatty acids or omega-3 rich foods, legumes, inflammation lowering spices. So there are some spices that can really help with inflammation, increasing our water and fiber. And something I just want to touch on briefly, we'll come back to as well. This is sort of another cutting edge thing, which is so intriguing. It's circadian eating. People talk about circadian fasting. I don't like that. I like circadian eating. I think that's more of a positive spin. It's when you can do, not what you can't do. And there's data to show that it decreases pain, inflammation, immune function is improved. You have better gut health, better metabolism, better sleep, and for some people, better weight control. And what it refers to is intermittent fasting, but really more eating during daylight hours and limiting your intake late at night, even after sunset, depending on your climate and zone. So yeah, it's something we delve into in the Integrative Center a lot. So getting back to our original diagram, we've sort of talked a lot about refuel of the food, getting into the exercise, portion or activity, because it doesn't have to be formal exercise. There's really no age limit, right? It correlates to longevity measures like telomeres. It helps maintain muscle mass and delay frailty. Can help with things like fractures, dementia, osteoporosis. It can help with a lot of inflammatory diseases. I like to call this a secret sauce. So if you look at the top here of the image, these are the 4 sort of secret sauce things that activity and movement trigger. They release endorphins, which are natural opioids. They activate your natural endocannabinoid system or medical marijuana type system. They improve your mood through serotonin, and they help with inflammation. So increasing your activity and exercise, it's almost like replacing opioids, marijuana, antidepressants, and Advil or Aleve all in one. And it doesn't have to be formal exercise. It's more about more activity throughout the day and more often. That's actually better than doing 30 minutes at the gym really hard and then sitting at a desk the rest of the day and then sleeping. It's better to break up the activity throughout the day and whatever you could tolerate with your pain. So with a lot of my patients who have had orthopedic surgeries or who are due to have orthopedic surgeries, we'll talk about how to add little spurts of activity through their day because it's hard for them to do a lot at once and they can still get all these benefits. Going back to the circadian talk, there's some studies that have found that there's better times to exercise. For some people, it's morning, for some people, it's afternoon, but it can actually help sync your cortisol rise, which is what you want in the morning, keep you awake and alert. And it can also help with your melatonin rise later, which will help ease you into sleep naturally. So certain times of exercise are better than others. And this is a neat study that just came out last year in the Sports Medicine Journal, and it's a micro boost, right? So the practical tip, light walking after a meal, even just for 5 minutes, can reduce blood sugar and insulin levels. This can help with inflammation overall. It can also help with pain. And if you can do something within 60 to 90 minutes of eating, that's especially good. And if the weather's not good, you can't go for a walk or your neighborhood isn't the best place to go for a walk in the evening. You can also just do household chores, which doesn't sound fun. Some people also just do squats. They'll do 20 squats broken up into two 10 sets. You can walk around your house, you could dance it out, but just moving after eating as opposed to eating and then going right to TV or reading can be helpful. So more than steps. Again, the idea is not necessarily to add a lot of formal exercise or blocked off time because a lot of us are really busy. It's adding activities you enjoy more to your day. Trying to use the steps. I don't think I have to say more about that. Sit to stand desk, taking a daily walk. And this goes beyond just activity. There's a lot of data about a term called nature deficit disorder, or a lack of time in nature that we spend in our modern society, how that affects our health and not just our physical well-being, but our mental well-being. Some people would do a move alarm. So my brother works for a computer tech company and he'll set his alarm to get up every hour, just do some shoulder shrugs, neck rolls, a couple of back stretches and get right back to the project. Parking further away and really thinking this is an investment in your future. It's what you can do now to help yourself later. These are some stretches that we go over sometimes for at a home desk or in the office. And then getting into recharge, so sort of the middle circle. This is where that circadian comes back. You can tell it's one of my favorite topics. There's just so much cool research coming out about this right now. As we age, unfortunately, our circadian clock sometimes gets a little bit out of whack. And so we really need to focus on optimizing our circadian health. Shift work can cause a problem, jet lag, and also kind of like people who have one sleep schedule during weekdays and different on weekends, maybe for social activities or other reasons, that can really throw off our circadian health and our rhythm. And so we want to focus on ways to optimize that. So a disrupted clock leads to all these things here, including heart disease, hypertension, impaired muscle function, and poor sleep. If we kind of optimize our sleep and stick to a sleep schedule and follow circadian patterns, it's actually been shown to improve muscle reaction time. So it can improve not just your strength, but performance, your cognitive or thinking abilities, as well as some of your heart health. So what I like to do for a microboost here is some of these things we go through in the integrative center and in the book is coming up with a plan for evening time and bedtime, way to kind of wind down and take that melatonin rise nicely into sleep and have some quality sleep. There's a lot of integrative options we have to do that. I won't dwell on that. And in the interest of time, we'll sort of keep it rolling, but The next part is refresh, and it's about stress. So I think many of you recognize this at some point in your life, that stress activates the sympathetic or fight and flight response, and it causes more muscle tension and more pain. And it can actually lead to increased chronic pain and ongoing inflammation. So we really want to work on decreasing the stress response. Unless you have not been around in the last maybe decade. I'm sure you've heard of mindfulness-based stress reduction, right? And so there's a lot of data that shows that this helps with chronic pain. It also helps with quality of life, and it helps reduce inflammation. So it's really something that we work on in the Integrative Center. You can use apps. There's a lot of free apps to use. And you can also just have a mantra or a saying that you like and repeat to yourself. You can do breath work, and this can all help with mindfulness. You can also just be present. So even right now, is, are you zooming into what we're talking about? Are you thinking about lunch, thinking about what you have to do tomorrow? Is your mind everywhere? And so just learning to be more present and mindful can actually help with inflammation, stress, and pain. These are the benefits. I mean, it pretty much helps everything. Well-being is part of stress reduction, and so sort of supporting good well-being, and it's having more positive emotions and negative emotions. And I don't love the positive negative, because all emotions are important and valid, and it's a spectrum. That's sort of the way it's defined by the CDC. Feeling satisfied with life, having sort of like an idea that you're going the right direction and things are moving the way you want, even if it's not perfect. So if we were in person, I'd sort of go through this list, but there's been data about what people think makes them happy and increases their well-being. It's usually things like this, which are usually a lot of external and then some internal things, but job promotion, a new job, being thinner, a new relationship, looking younger, extra money, extra time. So this is sort of the word cloud for what people think will help them increase their well-being and feel happier. But studies have shown the things that actually help are spending more time and supporting your relationships you have with good family and friends, easily being thankful for what you have, being willing to help each other, so doing pro-social acts, thinking of the future optimistically, not perfect, but just optimistic, savoring joyful moments, so recognizing when something is good and really enjoying it and thinking back about it and remembering it. Other times it's staying present when you're with family and friends and really being engaged in that movement, daily movement, exercise, and sort of an overall long-term purpose and good coping skills. This is more what this bubble looks like, or cloud, and that's what we really focus on. And the microboost is, you can't do all of this all at once. So it's working with you to break it down to what makes sense in your day. And maybe if you only have 5 minutes for this or 10 minutes, how we can do it, when we can do it. There's lots of things. There's gratitude practice, there's volunteering, there's forest bathing, there's all walks. There's a lot we can do to help reduce inflammation and stress, sort of from a mental and emotional well-being health too, that translates to better physical health, less pain, and less inflammation. A sneaky way, like I mentioned earlier, is to work on breath work. And one is just doing a long exhale. And this is something I teach my patients too in the program, the different breathing techniques. This has been shown to activate the parasympathetic system or relaxation response. It lowers heart rate, lowers blood pressure, slows down breathing, and it can help relax tight muscles. And the last little bubble here is relationships. This is a whole talk in itself, but I just want to touch on it. You can get stuck in a dangerous pain cycle if you don't have good social support, if you don't have a lot of connection with other people. So we really try to make an effort to schedule in daily time to connect with people, either at work or at home or on the phone, so that you have more support and don't sort of get caught in a pain cycle. This is a big overview of some of the micro boosts we use, and there's more in here than what we talked about. I just wanted to give you a zoomed out picture. And going back to the Orthopaedic Integrative Health Center, these are some of the top goals of people who have gone through the program: to decrease pain and discomfort, improve function, like activities of daily living, mobility, walking, to avoid further surgery or to prepare for surgery, to improve surgical recovery, to try to avoid pain pills or reduce pain pills. And the best one is to just build a wellness plan to live and age better. And this is a quote from a patient that we've had, who was wonderful. And she says that the ideas and suggestions were tailored specifically to me. And there are things that she could work on immediately, right? So the micro boosts, without much expense involved. She notes after her first visit, she began to feel more positive that she could indeed have things be better for her. In other words, I had hope for what my future could look like. We've asked other patients how has the program helped, and they've said the program's helped them focus on self-care, being calmer, but most importantly, the pain and discomfort in multiple areas, right hamstring, left hip, left knee, have improved a noticeable amount since my first visit. This has made a difference in my comfort level in general, also my daily functional abilities. I'm doing a lot more than before, both at home and out in my local community, which is exactly what we want. So we want people to participate in life and be more engaged and increase that health span. That was sort of the quote stuff. This is the actual objective data. So 84%, actually more than 84% of people were improved at 4 weeks, just after one visit and with a follow-up to see how they're doing. And we focus on these factors: nutrition, exercise, sleep, stress, relationships, to help decrease pain, inflammation, stress, and improve function. And I think we talked a little bit about this, but I do want to mention it's a 45-minute to 1 hour consultation with me to develop a customized care plan, followed by a visit with Phyllis, our excellent dietitian, and coordinated by Rebecca, our wonderful patient navigator. It's in the Bryn Mawr office, but we can also do telemedicine for certain areas. We have a lot on our website and on my personal website. This is our team. There's Phyllis and Rebecca. And like I said, we have lots of resources. We have blog posts on the Rothman website. I have a ton of blog posts on my own website. Instagram, I'm always posting daily health tips. This is the phone number if you're interested in talking about the Integrative Center. And hopefully that was helpful and you picked up some micro boosts that you can start with today. So thank you.
Thank you, Dr. Sharma. Great information. And I apologize if it's loud where I'm at. So I'll try and do these questions fairly quickly. Can you change fruit color every week instead of daily? I live alone, so fruit would be wasted.
Sure. I think that's a great idea. And I think the other way you may be able to do it is to add some frozen fruit. So buy something of whatever color, if you're starting with red, like apples and red bell peppers, and then you could have some frozen greens that you could add too, so you get more than one in the same week. I think that's great.
Is there an orthopedic integrative health center in South Jersey?
Not yet, but we could do telemedicine. If driving to Bryn Mawr is a little far, we could do a telemedicine visit, and that's totally fine too.
Great. A lot of questions about getting a copy of this presentation. Yes, we did record it, so I will make sure I send this out to you by next week. It takes a little bit to upload onto our YouTube page. So just know that this will be sent out. What results have you seen in those using CBD oil to help mitigate pain?
I think it can be helpful for people, especially if they have more superficial or topical pain. It's obviously the source of the CBD. Unfortunately, there you can get at the gas station now. It's just everywhere. So you want to make sure it's a quality source. There are certain brands that we recommend here, and then some of my colleagues also certify people for medical marijuana if you wanted a higher grade of that.
Is this covered by insurance? Will Medicare pay?
So right now it's out of pocket. We're working on insurance coverage, but it's a rate that's much lower than most people offer for 45 minutes to really an hour with a physician one-on-one with a customized plan. So if you were to come to the program, you actually fill out a pretty in-depth intake ahead of time, and I come up with a plan ahead of time. So I put a lot of time in it ahead. And again, using all this evidence-based resources in a really 5-hour program. Then when you come in, we tweak it, and you leave with a 3-page plus customized plan for you. So it's kind of really unique thing that we do here.
Is there a real difference with organic or not, since food prices are rising?
That's such a great question. Yeah, food prices are really skyrocketing. I think for organic, you want to focus on the Dirty Dozen. So if you go to the environmental work group, if you Google environmental work group in Dirty Dozen, they'll talk about the top 12 foods that carry the most pesticides if you don't do organic. So for those 12, try to do organic. And for the others, they also have the top 12 where you don't have to do organic. That could be a nice balance. But I agree that is a tricky topic.
Can we regrow cartilage?
So that's an interesting question. In theory, the answer would be yes, because our body's always changing. There's always turnover. I don't know. in terms of the science behind that, if I could say we can regrow it, I think we can definitely maintain cartilage. I think we can grow support structures around it. I think we can improve the muscles around the joint. So I think we can support what we have is probably the best answer.
Would this help someone with Wegener's disease?
I could, because there's always an inflammatory component. So this helps with inflammation. So I think that could be helpful. Keeping in mind, this is sort of focusing on those lifestyle factors to reduce inflammation. So I think it could be helpful for the inflammatory component.
Do you have any recommendations for the inflammatory spike that happens during the monthly menstrual cycle in females?
Yes, this is such a great topic. Okay, so I wrote a book and I have the picture right there, the pain solution in the 10 book, and a lot of it's on that. There's definitely inflammatory spike that happens, especially the week before the menstrual cycle, but at different periods. And I think that's when you sort of have to change some of your activities, but also your food, and increase the anti-inflammatory foods you're doing, but also increase the self-care in terms of more mindfulness activities, and decrease some of the intense exercise. So that's something we could work on as a team. If at the center, I could come up with a customized plan for you, even around your cycle.
How often do you refer patients to PT? If so, do you find it is helping patients become more compliant with the dietary lifestyle changes?
Yeah, we work closely with PT. When I see patients just in my regular offices, it's two in a standard sort of 15-minute visit. We will refer to PT a lot. I think it can help people. I think it's like anything, it's finding the right physical therapist for you, just like it's like finding the right physician for you. I think when we find a good fit, it can be really helpful. And we never want people to be in PT for, like years. The idea is to go for several weeks, get a program, and like it was said in the question, sort of add it to your lifestyle routine.
Where can we get a copy of your book?
Oh, it is on Amazon online. It's also on Target online, so you can use your red card points. But yeah, those are the best places.
When will your second book be published?
I am shopping with publishers, so it's not quite there yet, but I'm working on it.
What exercises can we do to address spinal pain in the neck and shoulder blade?
So I think that would be a really good question for a physical therapist who can do a custom plan for you. I could tell you some generic exercises. The problem is, depending on your condition, they might not be the right thing. For some people, you need more flexion based. For some people, you need more extension based, and it depends on what your x-rays and MRI show. So I think that would be something better to see you as a patient in a regular visits, or through the integrative center, or to work with a physical therapist.
Is CBD more effective for pain as an external oil on skin, or ingestion a few drops daily?
So typically ingestion is going to be more potent, but again, it goes back to the source. There was a company called Ananda that we did a study with before, and they have some pretty good quality products. And then if you want the actual, not hemp-based, those are hemp-based. If you want marijuana-based, then you would have to get certified. And like I said, some of my colleagues do that here.
Do you recommend a regular chiropractic adjustment?
I think it can help if you have sore muscles or tight muscles, and the chiropractor can sort of palpate those. I hate to recommend anything regular, because the concept is to become independent in your care. That's what we really want. And that's why a lot of medical doctors sort of lean towards physical therapists, because they give you exercises to do at home. I think it's okay to work with a chiropractor if you're really tight, but as long as he or she is also giving you exercises to do at home to maintain your strength and keep things in alignment, I think that's the best way.
Two more questions. Does this have any connection? Does the program, would that help with incontinence?
So it's not specifically for incontinence, really more for pain and inflammation. So yeah, it's not exactly designed specifically for that.
And last question, assuming you are compliant with the program, how soon can you start feeling better?
So some of the patients, and I had it in the quote section. I mean, she said the day she left, she was already working on things. And then in terms of the actual data, of our patients we've seen over the last year. No sugar, I can't put on the slide, but it was at 4 weeks. 84% of people reported they felt improved at 4 weeks. And the people who are not part of the 84%, they just said no change. So definitely no one got worse. And the majority of the people actually reported they felt better at 4 weeks.
Great. You have a lot of great content here. I really appreciate you taking the time, Dr. Sharma, and everyone who joined us today. Again, on the screen is Dr. Sharma's information and as well as our Orthopedic Integrative Health Center. And just a reminder, look out for a link I'll be sending you to our YouTube page once this presentation gets uploaded. So again, thank you everybody for coming today, and hopefully we'll chat with you soon.
Yeah, thank you so much. And I think the main message is we have the power to feel better. We don't have to always be dependent on pills and other things. And if we try and work on these things, we can sort of take back control of our health. So thank you.